This is April Van Huken. It's Pharmacology, NUR 136. The chapters we're going to cover in this recorded lecture are 30, 31, and 33. And we're going to start with Chapter 30, which is pituitary drugs. In order to understand pituitary drugs, you have to know a little bit about the pituitary hormones. The pituitary, this slide shows you all of the hormones in the pituitary, and they're divided into anterior or posterior. So anterior produce certain hormones, and posterior produce certain other hormones. They work together to control all the bodily functions, and they use something called the negative feedback loop. The negative feedback loop is something that helps to bring things back to normal. So it's a reaction that will cause a decrease in function in order to bring the hormone levels back to normal. Now, I know we're talking about the pituitary system, but I'm going to give you an example that's related to the pancreas, which is part of the endocrine system. So the pancreas is an important endocrine gland, and it relies on negative feedback to regulate blood glucose levels. So if there is a huge amount of glucose coming in, say from a big fatty meal, big McDonald's, Big Mac, and extra large fries, the negative feedback loop will trigger the pancreas to increase the amount of insulin that is produced. And that's negative feedback. It's bringing you to homeostasis. It is regulating everything. So I have posted a very nice YouTube video that goes, that's very simple, very short, and it tells you what the negative feedback loop is in more detail than I just did. But I ultimately want you to know that the negative feedback loop helps to regulate hormones, okay? The pituitary system, back to the pituitary, it's part of the larger endocrine system that creates hormones that regulate things like energy level, growth, emotions, reproductive ability, and so much more. The entire endocrine system is made up of pituitary, thyroid, pancreas, adrenal, and about 8 other things. And all of the hormones they produce are invaluable to human function. They help people maintain proper homeostasis. So there's the negative feedback loop, and then there's a positive feedback mechanism that just helps to maintain homeostasis. So please watch the video to help you understand the process and how these drugs work. That's the only reason I add these little extra videos. So I hope you know I'm not going to test you on the detail, but in order for you to really understand things and the drugs you're giving, you should have a little extra help with that kind of stuff. So pituitary drugs. Mechanism of action differs depending on the drug. So it either augments, which makes it seem like more, or antagonizes, which means makes it less or blocks the action. So the drugs do augment or antagonize the natural effects of the pituitary hormones. So there is, let's see, an anterior pituitary drug called cosentropin, which stimulates the release of cortisol. It has an anti-inflammatory effect. So think of hydrocortisone. It's like an anti-inflammatory. It's not hydrocortisone, but think of that. It's an anti-inflammatory effect. It's used for people who have adrenal cortical insufficiencies. This is also called Addison's disease, which is an intrinsic problem. Then there's a secondary, which is not intrinsic, it's extrinsic, reason that someone would take cosentropin, which would be the wasting away associated with HIV. So this drug promotes retention of sodium in the kidneys. It can result in swelling. It can result in hypertension, because think about it, you're retaining sodium. So you don't want to give it to somebody who has extreme hypertension, right? Because you'll make them get worse. You don't want to give it to somebody with other medical issues that cause edema, because you might make it worse. So this, let's see, there's another one, somatropin. is another example. The second example, it stimulates growth in patients who have hypopituitary dwarfism. It's used for people who don't have natural growth hormone. So it stimulates skeletal growth. So we have to, so when we're increasing growth, we want to make sure that it's working, right? And the way you make sure that it's working is you would have parents of children who are taking and keep a growth chart, maybe, right? Sometimes this medication is used for weight loss related to HIV, but there are lots of contraindications for this drug. So you wouldn't use it if you have cancer, if you have a retinopathy, if you are severely obese, or if you have severe lung problems. Then, let's see, the next one, octreotide. You will give this in your life as a nurse. It is a common drug. This drug is used for the watery diarrhea that people who have carcinoid tumors get, so it helps to prevent that. So it reduces severe diarrhea, flushing, and some people have something called a carcinoid crisis, which will cause severe, life-threatening hypotension. Octreotide is used for that. It just really helps. So from a nursing standpoint, the things you need to know about giving this drug would be to instruct patients to report abdominal pain, because this drug, octreotide, could impair gallbladder function. So if your gallbladder is not working, you're going to have really bad abdominal pain, especially if you eat a fatty meal. You'd use it in caution with patients with kidney impairment. You'd monitor glucose levels in patients because it can impact the glucose. It's given IV, IM, or sub-Q. Okay. So now on to posterior pituitary drugs. So these would be vasopressin and desmopressin. So these drugs, like the slide says, mimic the effect of the antidiuretic hormone. So they're going to help increase water reabsorption. They'll concentrate your urine. They'll reduce excretion by up to 90%. So vasopressin, they're going to help with antidiuretics, so you're not going to diurese, so you may retain water. They're used for people with diabetes insipidus, and I don't think you've gone over diabetes yet in 212. Diabetes insipidus is where they're peeing all the time. They're urinating all the time. So vasopressin and desmopressin help to stop that antidiuretic. Vasopressin is also a potent vasoconstrictor, so it's used in hypotensive emergencies. It's an advanced cardiac life support drug. It's used for pulseless cardiac arrest. It's also used to stop bleeding of esophageal varices, which is bleeding in the throat. It's just a real strong vasoconstrictor. Desmopressin is another one. It's used for a ton of things, but the absolute most common thing that it's used for is the management of nocturnal enuresis. And I'll let you guys look that up if you don't know what it is. It's also used to reduce frequent thirst, to treat diabetes insipidus. Diabetes insipidus is when they are urinating all of the time. It's used for all kinds of other things. All these drugs have unique adverse effects. We would need to perform a thorough nursing assessment and medication history. We would need to assess for contraindications, and we would teach our patients not to discontinue drugs abruptly and not to take over-the-counter products without checking with their healthcare provider. Therapeutic responses. There you go. Right on the slide. Chapter 31. Thyroid and anti-thyroid drugs. The thyroid gland is responsible for secreting 3 hormones that are essential for proper regulation of metabolism. So there's thyroxine, which is T4. There's triiodothyronine, which is T3. And there's calcitonin. Most of you have heard of hypothyroidism, so that's the term that's used to describe a deficiency in thyroid hormone. And then there's different terms for the different diseases. So there's primary if it's an abnormality in the thyroid gland itself. There would be secondary thyroid disease, and that would be where, like, if the pituitary gland doesn't work, so it doesn't secrete a thyroid stimulating hormone, and you don't have the thyroid stimulating hormone, so your thyroid doesn't work, that's a secondary dysfunction. And then there's even tertiary. So you have lots of different reasons for thyroid issues. A term that you should know is normal thyroid condition is called a euthyroid state. So it's EUTHYROID, euthyroid state, if you have hyperthyroid or hypothyroid or euthyroid. So you want to be euthyroid because that's normal. I included a short video in the week 13 folder that tells you differences in symptoms between hyper and hypothyroidism. It's a little bit obnoxious, but I'm hoping it helps you to remember. It may help when you're covering this in 212. I'm not testing you on the symptoms of hypo in this class. This is a drug class, but I'm just trying to throw everything out there that I can that might help you understand these conditions that the drugs we're going over are for. So I hope you like the obnoxious video. Okay, hypothyroidism. So there's all kinds of disorders that cause hypothyroidism. You could have congenital, which means you're not secreting enough when you're young. So your metabolism is low, your growth is slow, your sexual development is slow. You might even be mentally retarded. And it could be because of hypothyroidism. And if your metabolic rate is low, you're going to be overweight, most likely, unless they caught it and they're giving you medication. Myxedema is, as I've written in the slide, hyposecretion, so less secretion of the thyroid hormone during adulthood. So it's the same thing. Decreased metabolic rate, you've lost physical stamina, even mental stamina. Gain weight, lose some hair, you have some swelling, and you might even have a yellow dullness of the skin. So those are the signs that you have. Another disorder is called a goiter. So people will have a goiter. It'll be a big lump in their throat. Hey, that's my goiter. Some people don't do anything about it, and they still have this big thing in their throat. And some people have surgery. It just depends on the symptoms that you're having. A goiter is enlargement of the thyroid gland resulting from overstimulation and elevated levels of thyroid stimulating hormone, TSH. So TSH is elevated, but there's little or no thyroid hormone in circulation. So it's kind of weird. So it's large. The stimulating hormone has a lot of circulating around, but it's not stimulating anything. It's not making the thyroid hormone. So the symptoms common to each are listed up here. So all the indications listed are why we give these drugs. The mechanism of action, or how these drugs works, they replace what the thyroid gland cannot produce in attempt to achieve normal thyroid levels or a euthyroid state. The thyroid drugs work in the same exact way as endogenous thyroid hormones that you would develop in your body. Some people are on something called levothyroxine, which is Synthroid, probably the most common. So T4 is the one that's the most common hormone that we're deficient in. And then the other two, the liothyronine cytomel, sorry, I can't say that today, replaces T3. So levothyroxine is T4. It's most commonly called Synthroid, or Levoxyl. You will give it. Then the other one that I can't pronounce, the cytomel, T3. And then there's Liotrix, which is both of them. It's got a combination of T3 and T4. So they're used to replace what the thyroid can't produce. They're also used if somebody has a suspected hyperthyroidism, it'll help diagnose it. It'll prevent goiters from being from growing. So you can get more than one goiter, and it can prevent them. And then these drugs can replace hormone therapy in patients who've had their thyroid gland removed for various reasons. So they might have had hyperthyroidism, where it was producing too much thyroid hormone, and they had it removed, or they had thyroid cancer, and they had to have it removed. And there is something called hypothyroidism of pregnancy, where your thyroid doesn't work when you're pregnant, so you have to have some extra thyroid hormone. All kinds of reasons, okay? Adverse effects. Cardiac dysrhythmia is the most significant adverse effect. So if cardiac dysrhythmia is the most significant, signs of that would be tachycardia, palpitations, maybe some angina, maybe hypertension, maybe some other signs of hypertension or tachycardia would be insomnia, tremors, headache, anxiety, nausea, diarrhea, weight loss, sweating, so all those kind of things. So that's hypothyroidism. Now we're at hyperthyroidism. Hyperthyroidism is exactly what it says. Excessive thyroid hormones caused by several diseases that I've listed up there. I want to call out the thyroid storm. Thyroid storm is not a disease. It's induced by stress or infection. It's severe and potentially life-threatening, so it's just an overproduction of thyroid hormones. What happens in the body when someone has hyperthyroidism is this. You'll have an overall increase in metabolism, which causes symptoms such as diarrhea, flushing, increased appetite, muscle weakness, sleep disorders, altered menstrual flow, nervousness, heat intolerance, irritability, palpitations. They'll be tired. And the treatment, there's two treatments. Radioactive iodine is implanted in the thyroid, and it destroys the thyroid gland, so that's one. And then surgery. So surgery to remove all or part of the thyroid gland. And if you have your thyroid gland removed, you need thyroid medication for the rest of your life. When you are on these drugs, we obviously assess for therapeutic effect. We obviously teach patients. Any kind of hormone you take, anytime you as a nurse are administering a hormone, you want patients to take it at the same time every day, because you want them to maintain a consistent level of the drug in their system. So if somebody's taking thyroid medication, or if they're taking an estrogen, whatever, they need to take it usually in the morning, because some of these cause insomnia, but you want them to take them at the same time every day, and not to switch brands, because if you switch around, you might have a little bit of a deviation. Therapeutic effect of these drugs takes a few weeks. Let's see, if they're on an anticoagulant, the thyroid medication might enhance the activity of the anticoagulant. So what does that mean? Make it stronger or make it weaker? Enhance. It's going to make your blood thinner than it normally would, so you need to maybe have that dose adjusted or have your blood checked. Patients with diabetes may need increased dosages of insulin or any other hypoglycemic medications. And digoxin. Man, I can't tell you how many things digoxin interacts with, but thyroid medication is one of them. The serum levels will be lower. Monitor for adverse effects. We said they're cardiac dysrhythmias. Okay, chapter 33, adrenal drugs. The adrenal gland is part of the endocrine system, and it includes the adrenal cortex and the adrenal medulla. Each portion has different functions. They secrete different hormones. The adrenal medulla secretes catecholamines. Hopefully you'll remember what the epinephrine and norepinephrine do. They stimulate a sympathetic response. We've discussed these drugs in other lectures. Glucocorticoids and mineralocorticoids come from the adrenal cortex, and they inhibit or help control inflammatory and immune responses. So many reasons for giving these drugs. Look at all these indications. So, gastrointestinal diseases would be like ulcerative colitis or any kind of infection in the belly. Chronic respiratory illnesses like asthma exacerbations or COPD exacerbations. They even help stop bleeding in bleeding disorders. Just really great drugs to use. Contraindications, allergies of course. You wouldn't want to give a gluco or corticosteroid for a serious infection because it'll make the infection worse. Lots of drug interactions. You got to be careful when you give these meds. Lots of adverse effects. What you have to remember about the cardiovascular adverse effects is they're usually caused by the electrolyte imbalance that the adrenal drug causes. The adrenal drug's not causing the arrhythmia. The electrolyte imbalances. So if you've got somebody with an arrhythmia who's on a glucocorticoid, you might want to check their electrolytes, because that may be your problem. Do we know what some of the integumentary skin terms are? Petechiae, urticaria. These are common terms. Man, if I was teaching you 212, I'd be making sure you knew those. I should have put them in medical terminology, because you'll see this in nursing. You'll see hirsutism. Is that up there? Yeah, you'll see that. So look those terms up if you don't know them. So glucocorticoid, the most common one is prednisone. If you've got a really bad respiratory infection, you're given prednisone. It makes you hungry, makes you stay awake, makes you shake, makes you nervous, makes you sweat. It's awful to have to take a lot of it, and people have to taper it down when you come off of it. So maybe somebody will start you on 80 milligrams for 3 days, then they'll put you on 60 for 3 days, and then 40 for 3 days, and then 20 for 3 days. You wouldn't just stop it. You have to taper it down. Very commonly used for chronic respiratory illnesses, any kind of immunosuppressant purpose, but it is not adequate for managing Addison's disease. Solumedrol is another common one. Solumedrol is what is the little vials where you push the little stopper in and shake the med up. That's the most commonly used injectable glucocorticoid drug. So prednisone is the most common pill. Okay, Solumedrol is the most common injectable, and it's used for the same things. So they're used mostly for chronic respiratory illnesses or bad anti-inflammatory issues. Nursing implications. We want to assess, right? We want to know blood pressure for sure. We want to assess for edema. We want to assess for baseline electrolyte imbalances, because we know these drugs cause electrolyte imbalances. They may alter serum glucose, so we want to monitor that as well. We want to give the oral meds with food or milk, because we know that steroids upset the stomach. We don't want to give with NSAIDs or aspirin, because that'll compound the stomach upsetting issue. Some of these drugs are nasal. So nasal corticosteroids, you have to teach them how to do a nasal spray. Some people don't know. After after orally inhaled corticosteroids, people have to rinse their mouth because these will cause fungal infections in the mouth. Let's see. The immune response is reduced when patients are taking corticosteroids, so we don't want those people around sick people. And if they get fever, or if they start getting a sore throat, or any kind of weakness or lethargy that might make them think that, or temperature, they need to report it to their doctor because they'll have to come off of the steroid, be put on something different, or be put in the hospital and monitored closely. Patients should be taught to take adrenal medications at the same time every day, usually in the morning with meals or food because of the stomach upset. Sudden discontinuation of these drugs can cause something called an adrenal crisis, because you go into crisis when you have a sudden drop in levels of cortisol, and that's what these drugs are. Let's see. Got all these questions here, and what I want to remind you is some of the answers are in the slides. There's about 13 questions. Some of the answers are in the slides, and some of the answers you have to look up, and I think looking them up is a good exercise for you. So I hope that you find them useful and you may see them in the future. 26 minutes, and that's as long as this lecture is. Hopefully the next one will be just as short. Thanks.